Hammaga Dehlidan assalomu alaykum. Bugun biz Dehliga kelishimizdan maqsad Max Health kompaniyasini rahbarlari bizni Max shirkatidagi Max Speciality yangi klinikani ochilishiga taklif qilishdi. Biz bu taklifni mamnuniyat bilan qabul qildik va bizni kuzatib borsangiz, biz sizga rahbariyat bizni tanishtirgan va ko'rsatgan yangi klinikani obzorini qilib boramiz. Yaxshimisiz, tuzimisiz, yaxshi yuribsizmi? Sizni ko'rgani keldim.
Rahmat, kelinglar.
Andijoningizni ko'rgani keldim. Please. Assalomu alaykum. Amakijon, yaxshimisiz, tuzimisiz, yaxshi yuribsizmi? Tele komanda doktorlarni olib keldim ko'rishga sizni. 2 kunga keldim, lekin sizni ko'rmasdan ketmayman deb doktorlarga yetdim. Yaxshimisiz, tuzuk bo'lib qoldingizmi? Hammasi yaxshimi? Ha, mashalloh, mashalloh. Ikkinchi marta beramiz dedilar. Ozgina sabr qildi, bo'ldi. Amakijon, sizni ko'rib rosa xursand bo'ldim. Xo'p.
As you see, this is the Max Smart Hospital. We have just started this tower 3 months back. Okay, this is the main lobby over here. The whole hospital is 650 bedded. Okay, in which we have 7 ICUs and other normal beds. Even in this, we have added onco daycare where we have 40 beds, and in one day we can accommodate like 120 chemotherapies in one day. Okay, so we will go from here and we will go to the onco daycare to check out all the cabins for the onco patients. Because the patient, when they come for the chemo, they need a very normal environment, comfortable environment to get their chemotherapy done. So we'll just go and see the onco daycare.
Okay.
So this is the international lounge. This is the new lounge that we have made. So this is the main reception over here. As you can see, these counters are for the admission and registration. So everything is done over here as soon as the patient comes. And even the OPD billing is done from here.
Yeah.
Please come. I'll just show you the
Let me
lounge.
introduce Rohit. He
Hello,
can speak
hello.
your language. He's taking care of our CIS market. All the patients.
You Russian speak?
Yeah.
Yes.
All the patients come from Uzbek, Kazakh, Tajik, Turkmenistan.
Yeah.
He's the spokesman.
Oh, very nice.
Here,
Спасибо, очень приятно познакомиться. Nice to meet you.
if the patient is coming directly, there's a language barrier. We have the person who is taking care of.
Okay.
So we do all the counseling in all these rooms. Plus this is the whole sitting area. On the left hand side, this is the cafeteria area for the international patients. So this is mainly for international patients. And if we come to the goes to the end, on the left hand side, as you can see, it is a prayer
room
for the people who wants to pray for namaz and wants to pray.
Yes, namaz
So
khana.
this is the room for the namaz, and on that side the washrooms for the international patients that are separate.
Oh, very nice. Very nice. Very comfortable.
Very comfortable, right?
Yeah.
Dr. Riaz, what is bone marrow and what does it do in the body?
Okay, so bone marrow is an organ of in you little detail, just like heart, lung, liver, kidney, they are organs of the body. Heart is the pump, it pumps the blood. Liver is the detoxification and produces some enzymes. It's a produces digestive juices. In the same way, bone marrow is the soft part of the bone, the central soft part of the bone, and it produces blood cells and immune related cells. So in the blood cells, we have got RBC, WBC and platelets. RBC gives us hemoglobin, which carries oxygen from one part to different part of the body. WBC fights infection, and platelets helps us in preventing bleeding from any part. So this is a basic blood picture, and all these cells are produced in the bone marrow. So bone marrow is very important to have our healthy blood system and immune system.
Thank you, sir. Please, let's discuss CAR T cell, pediatric CAR T cell.
Okay, so CAR T cell is chimeric antigen receptor T cell therapy. Basically, the CAR T is made from body's own T lymphocyte. Okay, so the patient has, like any other normal human being, T cells, which are very important in killing the cancer cells. So how does this CAR T is made? We remove the T cells and send it to the lab, and where it is genetically modified to make CAR T, so that the T cells go back into the body and recognize the cancer cells and they kill it. So we have to just genetically modify these T cells and make a CAR T. It's just like a living drug. Now this therapy was first used in one of the pediatric patient called Emily Whitehead, and she is been now more than 15 years. She is doing well. She was a case of relapsed refractory B acute lymphoblastic leukemia. So from there, CAR T cell therapy started developing all over the world. Now one of the major indications to treat CAR T to treat patients of CAR T in pediatric group is relapsed B acute lymphoblastic leukemia. So this is one of the major. The other indications are lymphoma, that is more in adult, that another is multiple myeloma, that is also more in adult group. But in pediatric group, B acute lymphoblastic leukemia remains the choice for has a choice for CAR T. If the patient has failed allogenic bone marrow transplant, or the patient doesn't have a donor for allogenic bone marrow transplant, or the patient is a high risk and his or her MRD, minimal residual disease, is positive on chemotherapy, persistent MRD positivity, and they don't have any resource for going for allogenic bone marrow transplant in the family, or they don't have anything in the matched and related donor. So one of the main indications of doing the CAR T in pediatric is relapsed refractory B acute lymphoblastic leukemia.
Thank you, sir.
Today, I want to talk about this CAR T cell and bone marrow transplant. Which one better?
Okay, so when it comes to pediatric, because I'm specialized in a pediatric hematology oncology training. When we talk about pediatric, the last few years have just revolutionized the way we look at refractory or relapse cancers. And that landscape has changed because essentially the brushes that we are using that has changed. While 10 years back, the refractory leukemia or a relapse of cancer used to be at the end of the road. But now, over the last 10 years, the bone marrow transplants, number one, have become amazing because the way the transplant is done, the conditionings, the chemo that we are giving, they have become so less toxic. The GVHD, which is the major complication of transplants, have become very, very less. So it has essentially changed the entire spectrum. And in last 6 to 7 years, the new thing, which is CAR T cell therapy, definitely is amazing and definitely is a boon for all those children and all those families because it's essentially training your own body. It's essentially training your own T cells to kill the cancer.
Yeah.
Definitely, in certain cases where the tumors have come back very early during the therapy, just proves that the monster of the tumor is bigger than the chemo that you're giving them. So that is like in that scenario, CAR T is definitely better. And we definitely have that option to offer now to the families and giving them a new life in a better, less toxic way. For CAR T, we need certain bridging chemos so that the children are in remission before we hit them with that CAR T cells. But those chemos, those CAR T cells, the post CAR T experienced care, we are providing everything now.
The next question, immunotherapy or chemotherapy, which one is better?
So, very valid question, and once we parents ask us all the time. But definitely nowadays, immunotherapy would be the choice to go. Why? Because they are more targeted, they are safer, lesser side effect, better depth of remission, earlier remission to transplant, better bridge to transplant. It's a win-win, definitely. So if you ask how are half-match transplants a new thing, or are the half-match transplants in 2026 different from what we were looking at previously? So the answer is yes. Why? Because haploidentical transplant, or the term that we use, is a blessing for those who do not have a donor sitting at home. And how many of us have? There are only 25% of children who actually have a brother or sister who's a match and are eligible for the transplant, which is actually a consolidative therapy for their treatment. But now, with TCR alpha beta depletions, with PTCY conditionings, the half match transplants, the success have gone up. And we are touching up to 70 to 80% in haploidenticals, which is a big, big change of 2026 and requires a lot of expertise and supportive care. And we are sitting here for that.
Assalomu alaykum. Biz askdoctor kompaniyasi bilan birgalikda Hindistonda joylashgan Max klinikasiga keldik va bu yerdagi shart-sharoitlarni o'rgandik. Bemorlar, Toshkentdan kelgan, O'zbekistondan kelgan bemorlar juda ham mamnun. Biz shart-sharoitlarni ko'rib, mutaxassislarni ko'rib, sizlarga ushbu klinikada kelib davolanishni, o'ylamasdan, ikkilanmasdan kelib davolanishni tavsiya qilamiz.
Дорогие друзья, меня зовут Хайдарова Наргиз Тимировна. Я врач-невропатолог. Хочу поделиться бесценным опытом, который я недавно получила. По приглашению компании Ask Doctor я посетила клинику Макс в городе Нью-Дели. И почему жители Узбекистана выбирают лечение в Индии? Наблюдая своими глазами, я нашла 3 факта. Первое. Мировой уровень. Эта клиника имеет международные стандарты. Там работают врачи, оперируют хирурги с мировым именем, используют самые мировые передовые технологии, роботизированные системы, новейшие методы лучевой терапии, новейшие методы диагностики. Наши пациенты при приезде в Индию имеют большой комфорт получения сервиса, потому что имеется сильная команда русскоговорящих, узбекскоговорящих координаторов, переводчиков. Их встречают в аэропорту и сопровождают на всех этапах лечения. Очень большое значение имеет доступность лечения. При таком хорошем качестве лечения, которое не отстает, а в некоторых случаях даже превышает мировой уровень, имеется очень хорошая доступность в финансовом отношении. Здоровье – это самый ценный ресурс в жизни человека. Я вам рекомендую доверять ваше здоровье, вашей жизни лучшим профессионалам.